the passion? How did you get yourself into menstrual hygiene?
My apologies, I was trying to unmute and it had hang up. For me, my journey has been, I would say, quite long. And it's also personal in terms of the kind of passion that I developed. It's more personal to me because I went through stigma like many other girls when I was in primary school, when I just had my first menses and I didn't have the information. I didn't even have the products to manage it. So you can imagine the shame I went through back then. And it's something that almost drove me also to dropping out of school. But then again, I had support from my parents, and I think that is what kept me going. So when I got into the development space, I reflected that if I was going through this experience, then in terms of the work we were doing in school with water and sanitation, I got to engage a few girls just to have a sense of how they were feeling, when they are reaching adolescence and puberty. And one of the issues that arose was the dread for menstruation. And then I realized that that is a gap that needs to be really expanded on, particularly around breaking the silence. Thank you.
Thank you so much. Alfred, you are the gentleman among these ladies here. How did you find yourself in this sector?
For me, it started 8 years ago. At the time, I was working with the Kenya Medical Research Institute, specifically doing some work on the nexus or the intersection between WASH and neglected tropical diseases. Then my supervisor then got this amazing opportunity to develop, a sanitation and hygiene proposal for Kenya, which is now KSHIP, being implemented by AMREF. And, the donor required that to integrate MHM in that. And it was just actually the search for data that got me there. Quite interesting that we didn't have much data on MHM. And yeah, then the opportunity to work with WASH United, where we then integrated WASH into MHM and just collecting stories and data from East Africa and listening to women and girls' stories. I realized we needed to do more, and even now we still have a lot of work to do. So that's how I got into the space. And yeah, it looks like just the other day, but yeah, it's been quite some time, and interesting, so much progress, but still so much to do.
Yeah, and the first training on MHM that I ever received, you're the one who actually trained me on MHM in Uganda. Andros?
For me, it started when I started working in formal settlement. And I realized that issues of menstruation were never discussed. And when we met girls, they had quite, they were going through hard time. They were going through hard time. They didn't know who to talk to. They didn't know where to get things. They didn't know even what's all this about menstruation. And as a result of that, I developed that passion, and just to see girls being able to take control of their lives and having information about what menstruation is.
Thank you so much. I can see Umi. Umi, are you able to hear us?
Yes, I can hear you, but I think I'll need to find a better place. Suddenly, kuna mafundi wanajenga. I don't know what's going on, but yeah. So I'm Umi from Garissa, Kenya. I work with Kesha Alliance. And I think my interest for MHM has always been there, mostly because I managed to, honestly speaking, I haven't really had access to the product. But then sometimes when you're extremely privileged, you get to realize that there are things that you need to come up and do as an individual. So during our advocacy, because the biggest part of the project that Kesha Alliance does is access to quality education. But then this is something that comes with a lot of things. So there's the aspect of young girls who do not even have products like this. Girls who are at risk of marriage and FGM and all this. So I thought maybe with our team, we could advocate for the access to this product. And for a while now, we've been working with Safepad Kenya, one of the reusable products for MHM. And I think it's more of commitment as an organization that there has to be something we need to do as a team. So pretty much that's my story with MHM. This is a topic I'm very passionate about.
Thank you. You all have several years of experience in MHM, and I'd like to go back to you, IRENE. How is it now compared to 10 years ago? What has changed? You know, looking back 10 years ago and now, how is the state of MHM in Kenya? You've been in the sector for too long.
Oh, Victor, you make me sound like a fossil. Anyway, for me, honestly speaking, I would say that in Kenya, we've really made a lot of milestones. I would talk about pre-2015 because that is where now we can even start to get where the conversation has been moving, particularly around MHM, where the conversation has always been about parts. But pre-2015, it was worse because we weren't even talking about parts. People were still working in silos. We were still having a lot of stigma associated with MHM. You could not even include issues of MHM as part of the wash club discussions in schools because people are linking it more with sexual reproductive information. So they thought you were introducing issues of sex to girls. So the space was quite constrained then. But moving forward, I see we've had a lot of growth in the sector, particularly in terms of the capacities. Capacities in the sense that now across the different counties, Ministry of Health through other partners like WCC and UNICEF have made a lot of effort in building capacities. So we have people who can engage in discussions more objectively, but not just focusing on one aspect, addressing fundamental issues like awareness raising around the stigma and taboos, issues around the access to products, issues around disposal mechanism. I would also talk about the issues around coordination because that has quite improved. In the past, there has been a lot of independent engagement, different organizations doing their things and all that. I would also talk about progressive policy environment from the aspect of government intervention from 2017, where we had the presidential decree for the free sanitary towels. I've also talked about the media interest in this matter because we have seen a lot of conversations around MHM being profiled, and it's because of also the work that the media does that has put this discussion on the table and in different households. So yeah, the space has quite opened up a bit, and I'm really happy that you're making progress as a country.
Thank you so much. I'm moving from just sanitary towels to more inclusive approach. I think that is way better. Alfred, you touched a bit on data, and you know, what has been your experience specifically when looking into data and what informs our programming? How has that been for you? You know, just looking into the approach of data to inform some of the things that we are doing.
Yeah, I think I totally agree with IRENE where we've come from, you know, pre-2015 and now. We still have quite a number of gaps in terms of evidence. At the time, we had a lot of people doing something somewhere. It wasn't measured. And even if it was measured, we couldn't, we were all struggling with how, you know, like issues around inference, how could we infer that, you know, this change was as a result of providing, let's say, menstrual health materials. But that has since changed. We now have a few indicators that we are working from. So even now, we are not starting from scratch. I think the Zan Africa study in Kilifi, the RCT, you know, it's supposed to be coming out sometime this year or maybe next year, but it's going to give us really good data. It was a huge study with a big sample size. You know, the pre-MHM policy data that was collected by Maseno University, again, giving us a really good insight. But then a lot of researchers coming up to link MHM to broader issues around SRHR and really basically issues around like the life cycle of a woman and not just menstruation. So that's been changing. Julie Enegan doing amazing stuff, you know, with the tool that you can use to contextualize in your own context to collect data. that has since changed. In terms of knowledge and awareness, again, that has also changed. We now have people quite aware about MHM and talking about it. I remember when we started then, very few men were involved, but now a lot of men are actually intentionally being involved here, including, you, Victor, yourself, the likes of Neville, Atito Kinkaka, and so many other people. So we're getting really good data. The data is also helping us in programming. For instance, guys doing work in the wash sector, they are intentionally using data to design the different wash infrastructures. We are also not just going blindly to tackle issues around social norms and gender norms. We are also using data to guide us on that, and even policies. Obviously, Kenya, being the first country to have a standalone MHM policy, it's also not just from anywhere. It was, a policy that was involved or rather informed by data. So happy to see that a lot of us are now, interrogating data and using data to make decisions.
Thank you so much. And Rose, you work with Women of Girls, and LVCT is a very good organization. How is that for you in terms of what is changing currently in terms of?
What is changing? It's one of the things. It's what Irene talked about, that is coordination of partners. You find that previously everybody would go to a school and distribute whatever kind of sanitary pads that they want. But we have observed a point where partners are coming together and saying, you're going to this area, what can we bring together? What can we do to make this more improve the quality of the products that we're giving to the girls? Then also the information giving. Previously, things were not talked in open, and also even teachers, like in schools, were not very comfortable talking about issues of menstruation. But now you find that there's even a designated teacher that if a girl happens to get their periods while in school, they can be able to reach out to that teacher and be able to get the pads, and not only the pads, but also other sanitary things like the panties, so that she's able to change and continue with the studies. Here and there, we have had, although it's still, we are still yet together, but we have seen some community members coming in and supporting the issues of menstrual hygiene. We have seen some of them even volunteering to talk to the girls, to teach them, and some of them are men. So it's something that it's really good, and it's happening. And what we hope to see it being more talked about in community. It's not seen like it's a taboo, but seeing it in the areas that we implement, people talk about it more openly, and that girls don't feel that it's shame, but they can be able to talk to anyone because it's an issue that is talked about openly in the community.
Thank you. Umi?
Yes, sorry. I think from the time I've started advocating for this program, I think I would say there is improvement. We're at a time when even we're talking of launching the policy national level, but I feel like there's still a lot of effort to be done in terms of how to even access these products. Coming from the grassroots as an activist, I think we still have a long way to go, because I think we'll definitely get into this in the later part of the discussion, but in terms of even the products and the kind of things that we are sending down to the community, I don't think those are things I would definitely say would fast track our journey in terms of access and proper health issues in terms of MHM. I think there's still much that we can do, but there is improvement. There is a lot of progress that we've made since. There's a time when we wouldn't see products like this from where I come from. And today, at least I can say they're accessible in shops. So you can see that both the manufacturers and the country and the activists and people in these programs are doing their best. But I feel like there's a lot that can be done. I have my own reservations towards the kind of things that we are talking about as the products for MHM, but I think I'll get into this bit later in the discussion.
Thank you, Umi. And you brought a very good point. Over the past actually several years, I've had guys knock in my office with different products. Some of them you can basically judge from how you see them. These are not standard. And just coming to you now as a manufacturer and someone who might represent the manufacturer at this time. What are some of the challenges that you face as a manufacturer, considering that there are so many products right now in the market, and most organizations want to give out these products? How do you decide this is a good product that has been standardized? This one maybe. So just take us through that as a manufacturer.
Who, myself? I don't
No,
think
Alfred, sorry.
Oh, okay. Okay.
Alfred, yes.
Yeah, thank you so much, Victor. I mean, there are quite a number of challenges that manufacturers do face. Some of them have to do with the fact that we didn't have a good policy environment to tackle some of the challenges. For instance, it's quite expensive to import menstrual cups here because one, we don't have standards for menstrual cups. They are lumped together with medical devices. So it's quite expensive that you have to do a lot of independent tests because we don't have established tests that, KEBS would require for us to do. Then obviously the fact that there are a lot of bureaucracies before you can get them here. You have to, first of all, go to, Pharmacy and Poisons Board. Then you have to go to KEBS, you have to go to KRA, and those they have different systems that are not necessarily communicating together. So you can submit a document from Pharmacy and Poisons Board to KEBS, and KEBS requires another one from KRA, yet KRA would need you to have gotten the first one. So it's quite a lot of mixed up process to get them here. Then the other thing, obviously all of us would want to have, the manufacturing happening in Kenya, but then the raw materials are also very expensive. And, looking at the, economies of scale, then it's easier and cheaper to actually manufacture from outside than bringing to Kenya. Even for the other private sector manufacturers, for instance, sanitary pads companies, it's the same thing. The final product is zero rated, but the raw materials are not. So in the end, you would obviously want the final product to be cheaper, but you have to consider all those other inputs before the final product is here. So those are just some of the few challenges that I hope the policy will obviously address. And yeah, the fact that we don't have standards for some of these materials, then we have low or substandard products in the market. And the moment one particular product causes harm, then obviously all of you will be lumped together that you guys doing cups, you guys doing disposable pads, are producing substandard materials. So those are some of the challenges that manufacturers do face here in Kenya in particular.
Thank you, Alfred. Irene, you're a trainer, and having attended one of the trainings, you display all these products and you basically give the girls the right of choice. And that is one of the things that come up when you do the training. Does the girl have the choice? But then again, how do you ensure that when you address the issue of choice during the training, you also address, as Alfred has said, that the girls have to ensure that even whatever products that they choose meet the standards that is required by the government, and tying on with that with the standards that are met by the KEBS. So how do you deliver that during the training?
Thank you, Victor. Actually, the issue of products is something that has always been at the center of our conversations, because that is what everyone wants to talk about, but nobody wants to talk about what really works for the girls and also for the women and also for non-binary gender. So I will give an example, or not an example, I just want to give the context. So if you look at what UNFPA had published, if you look at the average age of onset menstruation, which is given as an average of 14 by UNFPA, we look at also the average age of menopause at 50. This gives you an indication that a woman will experience, or a girl would experience menses and its effects for a minimum of 36 years. So this is a natural biological process that she has to live with for 36 years. So what does this mean for us? We say that it is important for women and girls to know and also to learn the types of products that are best for their body needs. The type may not necessarily work for one person because people have different reactions to different products. So what we do, we provide a range of choices in the MHM lab, which we use for awareness raising and education. And the choice is letting them know what the different products do, what kind of options are there in the market, so that they can make the choice that works for them, because we believe that choice is not choice unless it is informed. So when you're talking about products, for me, the issue is more about the availability of that product, but also of the actual needs that the women, girls, and non-binary gender have for these products. So it is difficult even as a trainer to determine which product is appropriate in the sense of quality because of the issue around the KEBS regulation. We've had a push to have this actually set, the standard set. But as it is, as at now, we don't have the standards that have already been set that you can say that this product actually meets those preconditions. What we advocate for, particularly for women and girls and the non-binary gender, we tell them that it is important to know what works for you. If you feel itchy, if you feel this is not working for you, you don't have to use it because somebody else is using it, or because it is cheap, or because it is there in the market. Just use what works for you. So we don't advocate for any particular product, but we give them the right information so that they can make the informed choice about what would work for them. Thank you.
Thank you, Irene. To Anne-Rose, the organization, especially grassroots organizations, there's an issue of resources and access to these particular resources. How do you guys deal with that? And I'll also ask Umi to contribute on this. The access and how do you go and ensure that these women and girls have enough resources, even in terms of training, in terms of the product themselves?
The resources and it's a gap, and it's a big gap for girls in informal settlement. I will talk about this particular girl that I encountered in one of our school activity. And after we have talked about menstruation, menstrual hygiene, she came up and said that it's good that you have talked about this. However, we are two sisters and we only have 2 panties. So we share these 2 panties amongst us, and because during periods, so what we do is that during period, one of us has to go without a panty because the other one is using the panty during periods. And she went ahead and said it gets even worse when it rains, because when it rains, it means that the panties cannot get dried. So she will either not go to school, or she will just look for something to put on so that she goes to school. So that means that there's a lot of gaps. There are a lot of gaps, not only for actual sanitary pad, but the menstrual hygiene in general, from information to, because when they come to sharing panties, what does that mean, to even what it is that they put on, because they will look for anything that can be put on without minding what it is. So we have seen a lot of information gap, resources, they don't know which one is the best. So whatever quality comes, if they're given, they don't know whether it's best for me or it's not best for me. So what we have done is to try as much as possible to talk to them, to give them as much information as we can. And but also we are cognizant of the fact that in the areas that we work in, there's also the resource of water. So if you're telling the girls that, and especially if you're giving them reusable pads, or and you want them to keep on washing them, or even just general hygiene when they're having their periods, what does that mean to them? Because that water, it's a resource that it should be, they think that this cooking, it's more important than perhaps washing these parts, or perhaps by doing this. What does that mean to the girls? Then this also, even for the girls, and especially those that are out of school but they still need sanitary towels, is just juggling between feeding my child and buying sanitary towel. What comes first? Should I feed my child? Should I buy sanitary towels? So those are all gaps when it comes to issues of menstrual hygiene. And from an organizational point of view, what we have done is that for the girls that we've been reaching out and giving them, is to try as much as possible to give them a package. And this package will have a soap of the soap that the girls said this is a soap because it smells nice and all that. They're soap of choice. Then sanitary pads that will last them for about 3 months. We have 2 panties inside there. We have a face towel inside there, so that the girls, we call it a dignity pack, so that when we give them, it's something that it can last them. They don't have to worry about feeding their family or their child, but vis-a-vis taking issues, hygiene issues when it comes to menstruation.
Wow. And the fact that you work with women and girls in informal settlements, yes, is actually, and I know IRENE and Alfred, not only in formal settlement, but also in rural communities, to have water and all that. And we're going to come to that in a little bit. Omi? Omi?
Sorry.
Okay.
I think that what she said is very valid, and I totally agree with it. But I also think that we need political goodwill as well, because sometimes you look at how mostly the information, young girls really don't understand anything to do with MHM. And as much as we're talking about a policy and friendly policies coming up in the country, do they really know what's in the policy as we speak? Because from where I come from, you wouldn't expect a young lady down there in Garissa or Wajir or Mandera to really understand what the MHM policy talks about. So the biggest challenge right now would be access to the resources. What kind of product works best for you? And I don't like what I see completely recently, and this is not throwing shade on anyone, but also because I think it's becoming more of a competition, or like sort of conflict of interest, because you come to my town, you issue pads. What kind of products are you issuing? You've not informed the young girls what the product does to your body. This is probably a reusable product. What are the needs that come with the reusable products? You need constant access to water. Is that really accessible in a place like where I come from? Some things are a luxury. So I think even as we talk about access to these products, we need to also inform the young women who are using these products, what are the impact and what are the effects that come with it. Recently, I witnessed a group that was issuing the menstrual cups, and I was like, does this really work? Because honestly speaking, there are a lot of cultural issues that surround that topic. One would ask you, what can this product do to me? Can this interfere with maybe my virginity or something? But those are things that are never answered. People come down, they issue these products and leave it at that point. So I think as much as we are trying to improve these areas, we need also to share as much information as possible. I would also challenge the political group. Maybe it also needs goodwill. Each and every time we have politicians coming down, then you see them dishing out sanitary towels. Do they do it for the interest of the community, or do they do it for the interest of their image? But also, another thing I would also like to talk about is, as someone who's also in the peace sector, I like what has been done in every county. We have action plans on countering violent extremism. Can we also start discussing action plans on MHM at the county level? Now that we're launching the policy at the national level, coming down to the county level would more of, how would I put it, would be addressing that particular county and the challenges that come with it. Because every community comes with their own challenges. The informal sectors might have topics to do with maybe access to these materials due to poverty and other factors. From where I come from would be poverty, would be lack of information, because half of the people we're dealing with are illiterate. So they wouldn't really understand the factors that come with these things. So in terms of materializing these programs, you need to also tailor suit it to the communities that we're targeting. Probably have materials that speak the languages of these people. What does the MHM policy talk about? It talks about safe and hygienic pads, safe and hygienic disposals of these things. How can we address the taboos that surround sanitary towels? Because if you come to my community and you're issuing a sanitary towel on my face with cameras right there, I wouldn't really want to take it, because the first thing is, do I really want to be in the cameras? How is my privacy at this particular point? So most of the women don't come out to pick these products. As much as they want to know more about these things, they don't understand, because even the trainers who come down to the community level do not speak our language. Even if you speak Swahili, we don't really speak Swahili on a normal day. So there are a lot of things that we need to talk about. I think it's becoming more of a fancy thing to talk about MHM without really understanding the deeper interest of the particular community that we target.
Well, thank you so much. This is the right time to bring in IRENE, because Umi is actually addressing some of these things from grassroots point of view. So it seems that there's a gap in terms of what is happening at the national level and what is happening at the grassroots level. And I want to bring you in just specifically to touch on the policy, which is set to be launched tomorrow by the Ministry of Health. And Umi has addressed very, very key points. How do you ensure that the girls at the grassroots table have a clear understanding of this policy? What does it say? And to ensure that the implementation process to the grassroots level is meet to the latter. And what has gone into development of this policy? And how do we ensure that grassroots organizations understand this policy clearly? So please take us through that process. Like, what has gone through the development of this policy? What is in it? How would organization like benefit? What does the policy? How does it add value to them?
Thank you, Victor. I'm always passionate and happy to talk about the policy, the MHM policy that is going to be launched, because I have been part of the process. I was part of the team that even contributed to some of the content. So for me, I want to say that the policy process, actually the MHM policy, which is being launched tomorrow, is a baby that has taken too long to be delivered since 2016. So if this was a delivery, I would say we took 3 years to deliver the baby, and it has taken another 6 months for this baby to be presented, which is tomorrow. Of course, given that the government approved it last year in November 2019. So I would say that for me, I've looked at many policies because I've been engaged in MHM work across the globe in Asia and Africa. I've looked at different policies, including Ethiopia, which actually is the first standalone policy in Africa. They beat us to it, we took too long. But what I love about our policy is about the inclusiveness, one, of the process, but also of the aspiration that the policy has in the form of the 5 objectives that anchors it. So talking about the process, I would say from my perspective that it was inclusive in that it involved a lot of consultations. This time the government went over and above, not just to have boardroom meetings, but there was even engagement at the local level to have the voices of women, girls, people with disabilities, and non-binary gender just to contribute to this policy. We also had different stakeholders, including from the private sector, from the CSOs that were part of this process. So in terms of process, I would give it that it was participatory and not just as a checklist. It was participatory in the full sense that people were engaged. Now, in terms of what it has in store for the environment, the MHM environment for Kenya, I think looking at the 5 objectives, this gives it a very good launchpad for different agencies to make even better headways at the grassroots level. One, if you look at the first objective, which looks at the enabling environment, it is quite clear how it's going to bring the different levels of the government, both the national but also the county levels, to ensure that this is implemented through integration of the plans, both the annual plans, but also effectively in budgets. So it's not just a policy that is out there, that is just hanging like giving the intention of the government, but it is actually providing a framework how this would be cascaded even to the county level and by extension to the households that would be that are actually targeted. When you're looking at the second objective, which looks at breaking the silence around menstruation, to address issues around stigma, issues around myths and taboos, this is actually addressing one of the biggest challenges we have in Kenya. And I'm saying one of the biggest challenges because in my experience being in the MHM lab, I've heard from different girls, different women, different even non-binary gender who came out to say that they have a challenge because of some of the cultural issues, stigma related to even talking about menstruation. So for us, the biggest problem has actually been the issues around taboos, myths, and stigma in Kenya. And the policy provides a framework for addressing that in terms of awareness, but also in terms of coordination and engagement with the different actors to ensure that this is undertaken. The third objective, which looks at issues around products, also provides a framework for private sector engagement, but also fundamentally some of the issues we talked about, issues around making sure that what we have would add value, not just in terms of costs, but also looking at both awareness aspects, but also standards, which it is alluded to that the government will put in place regulatory measures to ensure that is addressed. Looking at the third objective again, when people talk about products, they just focus on pads. But menstrual products and consumables go beyond pads only. We look at facilities too. And the policy addresses that from the aspect of water being more accessible to people. So in essence, when you're talking about county budgets, it's not just looking at pads, but also looking at how best to improve facilities for menstrual management, both at institution level, but also at household level. So for me, I find that it has addressed also one of the challenges that we experience, even as practitioners, when we engage at the local level. Then the fourth aspect, which has also been a thorn, particularly if you look at some of the documentaries, but also if you just walk in your neighborhood, is the issue around disposal. And disposal is looking at how best to manage. So the policy addresses not just the availability of management products, but also how best this can be disposed in a way that we also conserve the environment. So again, that has also been well addressed in the policy. And for me, the most interesting part is the fifth objective, which is basically looking at the monitoring bit, but fundamentally also promoting issues around research and development. And I'm talking about research and development from the perspective that we cannot keep talking about the same thing and say that we are going to end period poverty by 2030 if we don't also start to address the needs of the people who have been left behind. Currently, we are addressing needs of people that can speak, people who voice their needs. But what about issues around the life cycle conundrum that you're looking at, even issues around incontinence? How do you address that to ensure everyone is included and you address the issue of period poverty? So for me, that fifth goal would address some of these things that we have been undertaking, particularly the blind spots. The blind spots in being more responsive to the local communities we are working around, not just in terms of product access, but also in terms of the information that would be well packaged in a way that it can meet them. So I would say that we have gains in that policy, gains that can only come alive if we, even as practitioners, do our part, because the government has set the environment in terms of a framework for engagement. And besides the policy, there is also the framework for implementation in the form of the strategy. So we are lucky that for Kenya, it wasn't just the policy that is going to be launched, but also a strategy to accompany it, a strategy that would give, in essence, the kind of framework that would be able to deliver this policy. So the strategy also looks at the different focus areas in terms of the 5 objectives. And those focus areas is what we can run with to ensure that it comes alive. Otherwise, it will just be this beautiful aspiration, which is just that, aspiration on paper, but without impact on the ground. Yeah.
Amazing. Thank you so much, Irene. And yeah, you for your contribution in the policy and taking us through the process. Alfred and Ross, what does this policy mean to private sector and non-governmental organizations? Alfred, I'll start with you. What does it mean to manufacturers and the private sector at large?
I think for us, it's definitely going to trigger new changes, and that would mean also amending other policies, because I mean, it won't work in isolation. For instance, what about the government sanitary pads project, where we only have distribution of sanitary pads, disposable sanitary pads only. When we have to be inclusive, we have to also think about issues around choice and preferences. So for me, I would obviously want to see that, girls in school choose whatever product they want, so long as, the product is safe and, the product has gone through the different processes. I would obviously also want to see a lot of consistency in the standards of the policy, within the policy, standards for all those different menstrual materials and products, not just cups, which I work with, but also period panties, disposable sanitary pads, reusable sanitary pads, and obviously, I want to see us amplifying, as Irene mentioned, the issue around education. Obviously, products alone don't solve the problem. I think it's very important that we tackle the issue from the root, and that has to do with tackling the stigma associated with menstruation. So I would obviously want to see the framework of the education aspect working very well. I know we've done quite a lot as a sector, but we still have a lot of work to do when it comes to tackling the stigma associated with menstruation. So for manufacturers, again, I would want, the ideal for me would want to see every product and having labels of all the materials or the chemicals used. So if it's a cup, then 100% medical grade silicone. If it's a disposable sanitary pad, what percentage is plastic, what percentage is cotton. I think that would help in also making choices for people. And I mean, it's unfortunate that we've seen in some of the situations where products being made in Europe by the same manufacturer are not the ones being sold here. They make different products that are then sold to different markets. So when it comes to, obviously, market segmentation is okay, but not when it also has to do with compromising on quality and leading to negative impacts on people's lives. So I would want to see that happening.
Well, thank you. And yeah. And Ross, before I come to you in a moment, thank you so much, participants, for joining us. If you have a question, please just put it on the chat box. My colleague Mercy will help address the questions. So please just put your questions on the chat box. Mercy, and Ross, sorry, you can go ahead.
Thank you. The policy and the strategy gives support to the work that we do, and also gives a framework to the work that we do at the grassroots, because the work has been done, but there have been no policy or guidance or framework, and mainly it has been on school health policy and other policies that are related. So having a menstrual hygiene management policy, this gives we can now anchor our work into that policy, and it supports the work that we do, but also it gives us guidance on how this should be done. And one of the key things that I'm happy it's included is the issue of the standards. As we have discussed, there have been many kind of products that have been given to the girls. Today it's this, tomorrow is that, tomorrow is this. But I think now that we have a framework, then it gives us guidance on what does it mean when you talk about menstrual hygiene. What does it mean? Which is this pack that we should be able to give to our women, to our girls? How should it be packaged? So that also it helps us, even as partners or as stakeholders, to come together and be able to work together and ensure that the qualities, and even the guy on the crowd, if this policy now can be disseminated in a way that that person in the community can be able to understand that this is the quality that should be able to get, then they're able to even advocate for better quality of products that are receiving from different corners, from different stakeholders. Then the other thing is the issue of research and development. This is an area that doesn't have a lot of data. So by having this policy in place and ensuring that it is implemented within those areas, then we will have a lot of data that will help us to improve in programming or reprogram, either the program or improve on what we've been doing. So I'm eagerly waiting for it so that we can be able to see where we step in and where we put in our work.
You and development, and specifically the issue of data.
Mm-hmm.
I'll come to that in a few minutes, but I want to go to Umi. Umi, what does this policy mean, to you as Kesho Alliance and other community organizations, state organizations? Is yet to be launched. So what does it mean?
I mean, I think this policy is a big win for women and girls in Kenya, because for one, it gives you the assurity that the work you do definitely has the support of the right stakeholders, the government being the biggest stakeholder, but also because one of the challenges that we've been having as with our partners was the fact that the product that they were trying to share out to the community was not actually approved by KEBS. And the biggest challenge was because the policy was not friendly enough for them to dominate the market. And you see that this is just a sample of the kind of challenges even manufacturers are going through. Sometimes the product is the right one, sometimes it speaks best to the need of the community, but you have no support from the policies that are out there already. So this one coming on board definitely is a big win, not even just for us actors at the ground, but also for the people that bring this by a call. But it also means that you have the right support from the government as a stakeholder and from the people that are also supporting the work that we do. So I think for me, this is a big win for us. And I specifically like the aspect that speaks about disposal. If you come down to the community and where I come from, you wouldn't really find the right disposal measures down there. You just find out the things are being thrown everywhere. Most of the times, the most accessible latrines are the pit latrines, where the more you throw these things inside, they get filled up. You have people who live in the camps who do not actually have the luxury of sinking latrines every other day, because also land is an issue. So for me, the disposal aspect is a big win for us, ensuring that even schools will have the right way to get rid of this product, supporting institutions to have the right disposal materials and the right way to go about this thing. So I think this comes with a lot of encouraging. How do I put this? It really speaks to where we are headed as a country and where we put our girls and women at the center of our development, because I think then that's one of the fastest ways to increase and advocate the support of young women to come out there. So I think for me, this speaks to the work that we do, and I would encourage maybe more countries to also adopt it so that we can move together in terms of addressing the MHM.
Thank you, Umi. IRENE and Alfred, you've been involved in a lot of research and data and in MHM specifically, what are some of the areas that still need a lot of research to go into? Like, we've seen people quoting 1 in 5 girls, miss school because of menstrual products, 3 in 10. So there's a lot of confusion that's out there. And if you go to different organizations, websites and everywhere else, you find all these things that, and even for us guys who specifically work in informal settlements, there's no data as such as far as how many girls actually go miss school because they lack sanitary towels. Do they miss school in the first place? And is it, other? So what are some of those areas that still need research, and lack sufficient data to be able to help various stakeholders make decisions?
Okay, I'll go first, and to build on the reflection you've had that we have very different figures, I would say that it is one of the things that people in research work grapple with, because I'm also in research and policy, in public policy as a scholar, and I know there is something called bias of self-report, where we lack objectivity because we want to report what would work for us. We want to escalate things that probably are not very reflective of the realities on the ground. Maybe because people are interested in funding, or maybe because people want to create a mountain out of an anthill. So the thing with research for me, I would say that particularly for MHM, there are different opportunities that we can leverage, particularly to have more robust research that can speak to our content. So I will talk about how we can put research into practice. One for me would be important to touch on information issues where we have gaps around research of specific marginalized groups on the menstrual health and hygiene management discourse. So for these groups, particularly if you're talking about the challenges that women and girls face, we forget that menstruation is an issue of life course. So you can't clump women and girls and say they have the same experiences. It is different. So how then do we start to have context-specific research to have different experiences, not just demonstrated, but documented, so that we have what is it in terms of experiences of, for example, women of this age group or girls of this age group, and for these specific marginalized groups, like people living in prisons. You find everyone now has started to flock to give pads in prisons. But is that the actual value that will give to women? Yes, it's a practical need to have a pad in prison. But what kind of strategic advocacy work can you do by trying to profile like the experiences of women in prison, or even a non-binary gender in prison, for example? Again, when you're talking of the needs in terms of research, I would say that apart from the information, then the issue of customization of products and facilities is important. And I'm saying it's important from the perspective that for most developers or for most manufacturers, when they're talking about product expansion, they forget the most important segment of that product. So how can we have research work that also profile the experiences of women and girls so that it can inform expansion of products, but also innovation that would put women and girls at the center of the entire value chain, even manufacturing in terms of storage, distribution, and also disposal. So again, for me, it would be interesting to have this kind of voices finding their way at the table, particularly if we're talking about research and development. There is quite a lot that has not been shared in terms of research. As earlier on mentioned, when you're talking about inclusion, for most people, we just talk about, oh, people with disability, and we leave it abstract as people with disability. But then again, we forget that disability is also not homogeneous. So how then do we have research pieces that looks at the different experiences of people with disability for the different types of disability we are dealing with. Again, another area that has been quite left out, which is also closely related to life course, but also conditions that people go through, is the issue around incontinence. How then do we profile? Incontinence is just the ability of someone not being able to hold their urine or their feces. So how do we have people with this condition who are menstruating? And I'm not just talking about women and girls, I'm also talking about the non-binary gender, which is always left out in this conversation. How do we ensure that their experiences can be used to improve the options that are available, not just in terms of product only, but also in terms of facilities to improve their menstrual management, but also issues around menstrual health. So for me, the field is really out there, but what would be more important is to look at those areas where the voices have not been brought to the table, not just to the table, in terms of profiling the actual need, but also the information we already have has not been packaged in a way that can reach these people to make some of the choices we have been discussing around. And of course, for me, particularly for Kenya, I would be interested in research that would look at what we've already done in terms of the free sanitary towels in school, just to see the kind of impact we have. And impact not just about numbers, but impact in terms of how responsive that program has been for the women and girls, because we have these budget figures that are put out there. Like last year we had, I think, about 460 million Kenya shillings, which was allocated for this initiative by the Ministry of Health, by the Ministry of Education, my apologies. But at the end of the day, we would want to see then again what kind of feedback we are getting to inform better development of that program, and not just in terms of additional budget allocation, but also in terms of additional process management. So the role of digital technology would also be key, particularly in management of the kind of information we have. Sorry, thank you. I took too long on that.
Thank you, Irene. Wow, those are, and I'm sure our friends at Aga Khan University, East Africa Institute are listening to those research gaps. You know, Alfred.
Yeah, I mean, there are quite a number of gaps in the space. I would start with, you know, for programmers, we have a lot of information, and sometimes it's anecdotal, but you've got to share it. I think sometimes you're afraid to share data from, you know, a research in 2 schools, but it gives us some really good insights. So I would obviously encourage practitioners to continue sharing, regardless of the size of the group or the sample size where they got the data from. It's through these small numbers coming together that we start seeing some themes that we need to explore. One big gap is actually on how to best engage men. A lot of people are trying, but from what I'm getting from our partners in different parts, they are really struggling with how best to engage men in MHM. We have a lot of people who are trying that, but we need to share more on that. Then obviously MHM or menstrual health and hygiene is not a standalone issue, or it's not in one particular sector. I mean, you go to environment, MHM will find home. You go to education, it will find home. Is it even a human rights issue? Is it a SRHR issue? So we need to link and actually have evidence that links you know, menstrual health to all these sectors. It's only through doing that that it will be prioritized by people in those particular sectors. Otherwise, when you go to environment, they won't see it as an issue. But then when you give them data of how much, you know, for instance, disposable sanitary pads are producing as waste out there, then the Ministry of Environment or the line ministries of environment will be interested it's only through sharing, you know, the challenges around myths and taboos and the stigma that guys in culture and social services will be interested in. And I totally agree with IRENE that people are talking of, you know, the specific sectors and running away. Yeah, like you just can't say MHM with people with disability and you leave it at that. We need evidence on how it impacts the different people of different abilities. And obviously the other bigger challenge has been that we focus on, you know, work in schools, which I totally understand. It's easier, you get approvals from different ministries, but at least you are guaranteed of, you know, being in those schools. But then what about the ones who are out of school? How best do we engage them? And the very last one, we totally forget to link all this to healthcare. Very few of us actually talking about, you know, the disorders or even diseases that come as a result of poor menstrual health and hygiene, or just the fact that we still have under-researched areas like endometriosis. It still takes close to 10 years before it can even be diagnosed. So we still have a lot of gaps when it comes to like the medical side of menstrual health, and we need a lot of work and research going into that. And the last one for me is that it's still underfunded. And so most people would, you know, go for the low hanging fruit, which is, yeah, do education, do distribution, and that's it. But then if it's well funded, people will also have, you know, some component that would go to evidence generation and dissemination and sharing. And when it comes to evidence generation and sharing, again, the academia process is also quite long and tedious in a way, because then you do a study in 2020 and you get the results in 2025. And, you know, it might not be necessarily valid at that time, or it might have outlived its time. So we have also to bear with the fact that that's how it is in academia, that it takes quite some time before the data is actually, you know, published. But I think we are making good progress with the different technical working groups and just the networking events and activities that people are able to share, you know, data from even their programs, not necessarily the very big research projects. And yeah, a lot of data a lot of research being done from outside. We need to also contextualize so that we don't end up just duplicating you know, work that, efforts that worked elsewhere and don't work here. So obviously contextualizing the different findings is very important, as we also work towards our own, even national indicator. Like unless it's being monitored by the government, it's not going to be sustainable. We want it to be part of the government monitoring system, that when, you know, guys in the field collect data, that feeds into the government. I think similar to the way the CLTS process and reporting is well coordinated, that they would know the number of villages which are ODF and which ones are not ODF. We definitely have to consider making such efforts that MHM data is also reported and acted upon in time.
Thank you, Alfred. We're about to wrap up the first session before we go to Q&A. And, you know, the elephant in the room right now is COVID. You know, we can't stop this conversation without touching on COVID. And tomorrow is Menstrual Hygiene Day. The theme is it's time for action. So how are you guys responding to COVID in your various areas? I'll start with you and Rose, then Umi, then Irene, then finally Alfred. How are you responding to this? What challenges are you addressing? And Rose.
Just before I respond on COVID, there's something that Alfred has talked about that I would like to emphasize, and it's the girls that are out of school. That most of the menstrual hygiene issues tend to reach out to the girls in school. But those that are out of school, there's a 15-year-old who is a teenage mother who is out in in the community, but there's no one to reach out to that particular girl. So even as the policy comes in and we start implementing the policy, we need to think beyond school. What can we do to that girl at the community level who does not go to any kind of formal school? Now, to COVID. Yes, this has posed with the school closure, with the girls' issues of social distancing and everything, it has posed a challenge. But for the organization that I work for, what we've been doing is that we have not stopped giving out the dignity pass to the girls. So we have we work with a group of girls at the community levels with the mentors. They're called mentors, and these mentors have a number of girls that they go they look up to them and just ensure that they're okay. So what we have done is that to work with the mentors, and we work with the mentors so that they can be able to know what their girls are experiencing, what are the issues that they're experiencing. In case there is any girl that needs sanitary pads, then the mentor now is able to refer the girl now to the sites. We have offices in all the informal settlements that we work in, so they're able to come to the site and say that this is what I need, and we have been giving them the dignity pack. And to add on that, we also been giving them some extra soap for them just to be able to ensure that they're keeping with the hygiene at the community level. Again, also in terms of messaging, we have been using our platform. We have a one-to-one youth hotline, which is a platform that broadcasts messages. So we've been able to send different kind of messages to the girls and the young women at the community, just educating them and letting them know that it's an interactive platform that they can interact, that they can ask any questions at any particular time. And in case they need any kind of support, they can let us know. So our offices are open, the hotline is open, and that's how we've been able to, we are trying to reach them. It's a challenge, we're reaching some of them, but with the mentor network, with all our offices open and the hotline, we've been able to reach quite a significant number of girls. Yeah.
Thank you, Anne-Rose. Umi?
Definitely, COVID has posed as a threat for women and girls in the community. But as an organization, we've been encouraging, we've been supporting groups, because right now there are a lot of drives going on. So what we've been doing, we've been supporting different drives at the grassroots level, where young girls are able to get these pads even when the schools are closed, but also encouraging the county government to come out, because our key partners are the local county governments. So encouraging particularly our county government to come out and support women groups, providing them with the right products and giving them the resources to continue with providing the materials for the women that we work with. And I also like what IRENE has mentioned. I think I would be very interested to see more research coming out, especially on what has worked so far, because I don't think what we are doing is extremely sustainable in terms of donations every other time. So maybe to see research surrounding the topic on what has worked on MHM so far and providing materials and products to women and girls in Kenya. I would definitely be interested in that particular research, and maybe even see how ways we can contribute if there are plans to come up with such research. Particularly us as Kesho, we focus on education and peace security programs, but then we definitely always have issues on MHM coming up. So we work with the right stakeholders. This research would be very key for us. So I would want to see maybe if there are plans on furthering that agenda.
Thank you, Umi. And Irene, just to add on, what are some of the things that you as a trainer and someone who's been in this sector for some time, during pandemic, do you really feel like organizations are prepared to respond in such time, even as you answer on what you've been doing? And if so, what are some of the things that you actually should really focus on at this time?
Thank you, Victor. I think COVID was a wake-up call for everyone. And everyone in the sense that it caught us all unawares. And it also helped to show where the gaps are in terms of interventions, but also in terms of the kind of way we are organized with our response. So I would say that the way COVID affected the sector that would be talking about issues around menstruation is the reality that people decided to just forget about it at some point. So the immediate response was about hand washing with soap, sanitize, wear a mask and all that. But people forgot the other bit about safe management of menstruation, particularly for women and girls who are also affected by this pandemic. So I always say that just as we all eat, sleep, and shit, people will still continue to menstruate during this outbreak now and even after the outbreak is gone. So when organizations mobilized to respond, most people went in with hand washing stations, went in with all the PPEs and all that. But I applaud the organizations that remember that we need to give dignity kits also for households, because they were already constrained with the economic situation. In the informal settlements where we are also supporting the response, we realized that there's a lot of gap. People could not even afford soap that we are saying that you need to use. And the use of soap had even, been, I would say it had increased at the household level because of the increased activity with hand washing that was being promoted. So besides the soap, again, some of the issues we got from the women was that, of course, for some people, they had shortages of pads in some areas, but without proper documentation of that, we couldn't say that how many areas were affected. And shortages of pads in the sense of distribution and availability in some shops, because some people decided to refocus, some of those local vendors decided to refocus on other things like food and other items that they felt would be fast moving. So for some vendors that personally had engaged with a vendor and asked, what are you restocking when you're in this COVID period? And the vendor's like, now what is selling is soap, what is selling is food. So that is what they prioritize. And then I was like, what about sanitary pads? That is a women's issue, they'll know how to manage. So this is a shopkeeper at the local level I was engaging with that gives you an insight that they think that with COVID, issues around menstruation are not important. They feel other things are a priority. So again, back to what Alfred was talking about, is this an issue of a human right or a sexual reproductive health? I would obviously say that even as the policy supports it, this is a human rights issue. It's addressed from that perspective. That is where you have also sexual reproductive health rights addressed. That is where you have issues around livelihoods, issues around participation, issues around dignity addressed. So if we don't look at this, as you're talking along having masks, we should be also asking, is that kitty, the non-food items you're giving to the local communities, or even the food baskets we are giving, does that kitty include a dignity kit also for the women and girls? We don't make assumptions, yes, but we can do something about it. As we were putting Hennessy in food baskets, we could also put pads in those food baskets. Yeah. So our response from Oxfam's perspective, of course, we have operations in different countries across the globe. We have different interventions on COVID. Some have the dignity kits. For Kenya, we prioritized on improving access to safe water in informal settlements, because we mapped the environment and we realized there was a lot going on in the informal settlements in terms of support for organizations who are trying to give the dignity kits. So we didn't want to duplicate. But I think there's still more that we can do, particularly in other areas, like probably like in prison areas and other hard-hit areas, including orphanages that are even left out in this conversation. Yeah.
Well, thank you, Irene. Alfred?
I think I could start by just showing you how our programming looks like so that you can see the impact of the COVID on our programs. So normally, just like Andros, we work through partners. We have 22 partners spread across 12 countries. So most of our partners use the mentorship program, or where they create safe spaces for girls to meet, or occasionally to discuss broader issues beyond just menstruation, and obviously using menstruation as the entry point to discuss all these issues. And they meet in groups of less than 30 with 1 or 2 mentors supporting them. Now, with COVID, that can never happen. We couldn't have sessions happening. Schools were closed because most of them do work in schools. Of course, we have some who work with girls and women and other menstruators who are out of school. So we thought, what was the best way to deal with that? So we have a few mentors who are able to do the door-to-door distribution and training, because unlike many other products, then a menstrual cup you can't just give out. It can't just be part of the, the NFIs. It has to be accompanied with training. So they are doing door-to-door trainings and supporting the girls in those communities, which is quite interesting, because ever since we started, we knew that context is very important. And for us, all trainings are actually done by Ruby Cup users. And these Ruby Cup users have to be based in those communities. So for those who have mentors within their localities, they continue to do that. We do follow-ups on 3 occasions, after 6 weeks, after 6 months, and after 1 year, to make sure that girls get supported in what we call sustained support, that they have someone they can call in case they have any challenges. But then the pandemic also brought a new group of vulnerable populations, interestingly, including health workers. So we looked at some of the studies done in China, including one in Wuhan, which showed that a lot of the PPEs were made with men in mind and not women in mind. So again, taking breaks to go and change became a big issue for female or menstruators in those particular regions. So we are now donating Ruby Cups to health workers, because then they are now working long hours, longer than before. And we've already done a few distributions. The first one went out in Turkana. We're doing a new one to Baringo soon. And so in case anyone has a group of healthcare workers who need Ruby Cups, and they have someone, more importantly, someone who is already a menstrual cup user who can train the rest, then we're happy to donate. Obviously, as Humi said, you don't want to give out products and they are, they are scattered all over or they are not used. So that's why we are very keen that within that particular hospital or within that particular setting, there is someone who is already a menstrual cup user to support the rest.
Thank you so much, Alfred, and thank you, panelists. I'll now hand you over to Mercy. There are so many questions, so please, Mercy, yes.
Okay, good afternoon, everyone, once again. Just to start with, I'll just give a brief about the East Africa Institute. Basically, our mission is to provide a coherent and impartial evidence-based platform for policy formulation and decision-making. So this discussion is very critical and important for us. And we are happy to get all the data that you're giving us as panelists, and even all the questions that are coming in. We are happy to just compile all this together and see how we can come up with a policy brief or just recommendations for policy, both now and in the future. So thank you so much. One of the questions is Benazil. He asked the uptake of MHM in the sexual reproductive space. Sexual reproductive health advice has been limited, and this is not just in Kenya but globally. How can organizations like Liverpool leverage on what has been done to scale up MHM, especially in the sexual reproductive health rights space? So maybe, Ambrose, you can answer.
I'm not sure if we, did you guys hear the question? No. Could you please?
Okay. So the first question is addressed to Anne-Rose, and the question is, the uptake of MHM in the sexual reproductive health rights space has been limited, and this is not just in Kenya, but globally. How can organizations like Liverpool leverage on what has been done to scale up MHM issues, especially in the sexual reproductive health rights space? Is that clear now?
Yeah, it's clear.
Okay, thank you.
well, we have different programs, and I think we already we are working in the issue of menstrual hygiene. I think what we need to do, and now with the policy at hand, is to ensure that we implement the policy to its fullest, and also utilize our other programs and our other areas of work, like gender-based violence, issues to do targeting the key populations. We just expand our reach to other vulnerable or key population. So this is already work in progress. It's something that we will continue working and just ensuring that we integrate this in our different programs.
Okay. There's another question by Marlon, actually 3 questions. Despite a lot of effort by the national government and other players aimed at sensitizing communities about menstrual hygiene management, research indicates that communities still perpetuate taboos and misconception about menstruation that restrict girls' mobility and activity during menstruation. What could be some of the solutions to this problem, which tends to cut across several Kenyan communities? I think this question, I'll address it to Umi.
That's a good question, and I think the best way to address that would be more awareness, but awareness that is focused on that particular community that you're working with. Like, for instance, if maybe you're coming down to a community like a close cultured community, maybe like where I come from, you first of all need to understand the social norms and the cultural norms in that particular area. In terms of the products that you would want to advocate for, do you think that would work with the interest of that particular group? Because the biggest challenge that we have right now, and even me with all my education, with all my empowerment, I wouldn't really go back to my people and tell them, hey, here's a menstrual cup, can we start using it? Or here's a tampon, could you want to try it on? Because there are a lot of cultural issues that surround that. So the best way to address that would be awareness, but focusing on that particular group that you're targeting.
So basically what you mean is when you're going to community, you can approach it from a customized point of view, not really going with a one-size-fits-all.
Yes, you cannot have a blanketed solution for every other people that you work with. So maybe you've worked with in a place like Nairobi where people are more informed, but then you come to a rural place where people are not informed. There's illiteracy, there's a lot of factors that come into play. There's a culture itself. So you need to really understand the context of the people that you're dealing with first. And that's why I'm really advocating for action plans at the county level, because that would definitely solve a big issue that we're currently having. A lot of things don't work in different places, and that's because most of the times people have the good interest but lack the information to deal with that particular people.
Okay. Another question as well from Marlon. A tour in Kenyan schools, both at primary and secondary level, reveals that the quality of instruction by teachers on menstrual hygiene management varies significantly across the country. In some schools, the subject is comprehensively covered, while in others it is scantily tackled. What policy changes could ensure that this subject is given equal priority across schools? And I think this question, we should not just address the curriculum, but basically what should schools do, or what policy, in terms of policy, how can schools play a critical role when it comes to menstrual hygiene? Irene, can you answer that?
Yes, I'll respond to that, and I'll link it to the first question about sexual reproductive health and education, because most teachers, actually when you're looking at issues around menstruation, the problem is that there are myths associated with it to mean sex. And that is why you find that some teachers are quite uncomfortable discussing the topic, and they'll just run through it. Even if you put it in a curriculum, they'll just run through it. I remember there was a session we once had, a training session we once had, and the participant, who is a full-grown person, could not say the word vagina in front of people because of the cultural orientation, but also the way he was raised, I would say so. So when you're talking about how to make the environment, how to make more the education to be more responsive to issues around menstrual health and hygiene management, particularly in the context of the school. I would say that because understanding that from our cultural context, talking about comprehensive sexuality education is a challenge, what is important is to ask ourselves the critical components we want to address to empower the girl or the boy. So there are international guidelines on sexuality education that are out there, ITGSE 2018. It's a very good tool that teachers and also practitioners who are working in the school context can reference in the development of a curriculum for the different age groups. So when you reflect on what the standards in the ITGSE say, you are at a more comfortable level to communicate the information without feeling like, oh, maybe you're violating your upbringing needs. But this again goes back to the issue of the stigma and taboos that are associated with menstrual education. So back to how the policy is addressing this. The policy is quite clear, particularly if you're talking about Objective 2, which is looking at breaking the silence around... Sorry? Hello? Okay, so the policy is quite clear how to... is there a question?
No, please go ahead.
Okay, the policy is quite clear around taking the first step, which is breaking the silence, to also enable better conversation around matters menstruation. And on breaking the silence, it goes beyond the government's responsibility, which is the structural, that provides for that enabling environment for people to address issues menstruation. It looks at the role of communities. And when I talk about the role of communities, it specifically addresses the role of parents and communities, particularly in terms of having a collective dialogue around MHM. So there has been effort on that space to ensure that conversation is opened up, not just in terms of cross-generational dialogue between parents and their children, but also across different peers. And then I would also want to raise the issue of the different messaging that some teachers give. That is a gap that had been realized 2 years back, actually years back, but there has been intervention in that space through Ministry of Health, who brought together stakeholders and harmonized messages around menstrual hygiene management. There's even a book, there's an instructional book for teachers in schools that has been developed, and I think it had been already approved last year to promote matters menstrual health and hygiene management in schools, looking holistically at issues around breaking silence, but also around the infrastructure and facilities, around product management, around disposals, and around the engagement of school management beyond the boards, but also the parents and the local community. So that is also another instructional material that would be quite important for people who are working in a school setup, but also who are building the capacity of teachers. And just to end this, again, for me, is the issue of political leadership that Umi had alluded to, but going beyond the policymakers, how do we include local leaders who can also act as champions? When you hear somebody, even using a male champion, for example, who is renowned in a community talking of matters menstruation, you'd find that it opens up space for people to feel that it's something that they can talk about. So I think it's having that a mix of approaches that can really make this subject come out of the closet so that people can start talking about menstruation in a way that can add value to women and girls and non-binary gender.
Thank you, Irene, for that. And I think that leads us to the next question by Dr. Kitui, the EAI director. Is currently packaged, the sanitary pad adverts on TV seem to target the converted listeners. We see girls dancing, then see ink being poured on a pad, which hasn't been explained to the audience. I personally struggle to listen and understand the message in the songs and wonder how young 10-year-olds will make it. It seems girls should better receive this information. Is there a way that this information can be better packaged for young girls? I think Alfred can answer this. from manufacturers' point of view?
Yeah, I mean, I totally agree, and I get the point that some of these adverts are trying to pass across that, menstruation is cool, it's something to be celebrated. But yeah, we've also got to be practical and real about it and not use the blue liquid to represent the menstrual flow. It's not blue anyway, so I have never understood why people would use that. But I think you have to be very inclusive in how you engage and how you advertise your product out there. So we need to understand that different products work for different people. And we've also got to engage with different stakeholders, including the government. So for instance, Irene just mentioned about the 13 key messages that the Ministry of Health has developed. If you are a manufacturer and you don't even have access to that information, then you might not package your adverts the right way. But if you have access to that information and you know what the government wants us to communicate, because I mean, we are all addressing the same issue, just differently. So we've got to work together with different stakeholders so that we are tackling the same issue differently, but addressing it holistically. There are different ways of engaging with the communities or targeting these young women and girls and other menstruators. I think a very strategic one would obviously target them before they start menstruating. That is ideally the best point, and it can start as early as 9 years so that when it happens, it's not already a shock to them. Otherwise, most of the time, we intervene when kind of damage has already been done. So it's important that we intervene before they've started menstruating and that they know that they have different options, not just one product. For instance, in our curriculum at RubyCap, which is open source, anyone can get access to the curriculum. We train on all menstrual products that are available in that particular locality. And the reason we also use people from those particular communities is because they understand the context and which product are there. You train them on how to use, how to dispose, how to safely manage all the menstrual product. Then you go into detail about your product. And obviously it's very expensive to do the education, but I mean, it's a wake-up call that products alone don't solve a problem. So whether it's within your CSR or whichever other model you want to use, then make sure that the education component is there. For instance, for us, we have an in-build program. For every cup you buy, we donate another one. So that's like part of us, that every cup we sell, we donate another one. So like education for us is compulsory, it's given, it's non-negotiable. But obviously that works for us. It might not work for others, but I think the ingredients of sustainability have to be thought about, whether you want to do this through communities or organizations that are based on the ground like we do, or whether you want to already look for organizations that are already doing it and partnering with them. So, I mean, there is not one solution, but I think the community engagement is very important, even for even the adverts, so that it makes sense. And it also has to, as Irene said, has to break the silence. Like, it shouldn't just be an advert that won't keep people talking. I think we need adverts that are already informational enough and transformational enough that it will trigger people to talk about it and to address the issue.
Thank you, Alfred. And I think that's a good point when it comes to manufacturers to just be very intentional when it comes to their marketing strategies. And I believe that's something that should be adopted by manufacturers across different menstrual products, especially when it comes to disposal, and also looking at the age group of the menstruators that they want to target, especially when it comes to schools and other avenues. And now there's another question. What conversations, it's by Joyce Wangu, what conversations do we need to have on menstruation at the workplace? especially so that men become more comfortable with this topic and understand the support that women need during their cycles, and also so that men do not cringe at the sight of bloodstain. I think this is a discussion that needs both at a discussion phase and a policy aspect. So Irene, probably answer.
Thank you, Mercy. I'll just pick up from what Alfred has mentioned, because menstruation does not occur abstractly. It also occurs in spaces. It can be at household level, it can be at institutional level. But if we approach it, I always look at it from the perspective that it starts right from our nurturing, our orientation growing up. So by the time we are old enough, you either are comfortable with it or you still have a problem with it. So starting with that education, nurturing the boys from an early age to know that it is a normal biological process that women and girls and non-binary gender have to go through. It is something that would help as they grow into men eventually. But now dealing with the immediate concerns where you're having already full-grown men who have a challenge with this, then the issue around policy, as you mentioned it, is important. But then again, policy can also be just something on paper if it's not actualized in the form of dialogue around menstruation. So when you're talking about some of these sessions we have at workplace, for example, on life skills or on fire drills and all this, how can people in workplace ensure that part of the conversation they have about around safety and also interactions in the workplace is more inclusive and equitable, appreciating that life experiences can be very different depending on where one comes from. So I would say that having those conversations as part of the day-to-day workplace engagement can also help in breaking the silence. So the starting point would be to have that silence broken around it. We talk about it more often. Then the next part is to ensure that we also have some of the products available to ensure that people can safely manage. I know that some people can be triggered by hormonal, reaction to even start their periods before their actual date. So how do you ensure that they can manage without feeling stigmatized or without feeling embarrassed when they're already working? Then again, also the issue of disposal. You find some workplaces where they have maybe just one toilet that is shared by everyone, but they don't have an appropriate disposal mechanism. They just have this open bucket for people to throw in their used sanitary towels, for example. It doesn't create also a good environment for everyone else using the facility. So how then do we promote that part of the enabling environment also includes having facilities available that women can also safely manage their menstruation, but also men do not feel so conscious about it. So when we break the silence, we provide the facility, we have the facility in terms of self-management, but also products, but also in terms of disposal. Again, we are going into a level where we can be more comfortable in the spaces that we work in. So it's all inclusive, both policy, but also promoting practice in the sense of talking about it and providing the right facilities.
Thank you, Irene. I think that's a very good point. Just today I came across a statistic from 2016 that says that only 12% of girls in Kenya will be comfortable receiving menstrual information from their mother. And only 50% of girls say they can discuss menstruation at home. So for me, I found this very interesting because I feel like you said, it starts from the stigma from home. You can imagine if a girl cannot discuss menstruation at home, what about the boys? And this is extrapolated now to the workplace, because then menstruation becomes a taboo for discussion even at the workplace. You find it very difficult to discuss policies or ways to ensure that employees or other female employees get a safe space to discuss menstruation, or they can be able to menstruate in a dignified manner at their workplace. And this is something that should be looked upon. And now there's a last question. Research has shown that the sanitation system in various parts of the country is not designed to meet the needs of menstruating people. The system will be strained with the increased disposal of used menstrual products. Are there efforts to ensure that we embed girl-friendly resources and design in both existing and future governmental infrastructure efforts? I don't know, I think Irene, you'll still be the one to answer that.
Sorry, I'm not unmuted. Thank you for that good question. What I want to share is that because, again, when it comes to government policy, the challenge has been the dissemination of that policy, which makes it difficult for practitioners to be able to engage. Way back, I think in 2017, we had some of the school infrastructure guidelines as part of the minimum standards that Ministry of Education had rolled out that actually provides for designs that have girl-friendly sanitation facilities. But not most practitioners are familiar with those guidelines and designs. And as an extension, by design, I think that there is a gap in that. But already the ministry has those designs available, so anyone can have access. Of course, the challenge has been trying to have designs that also speak to your context. You'll find that some of the government designs provide for water closets where you have to flush, for example, and all that. But your context, if you're working in the rural, maybe you don't have that water available. So how do you ensure that that toilet facility also has a bathroom which has running water, because nobody wants to have walk of shame from across a tank that has been put right at the assembly point, and you have to walk with it to the toilet, and everyone will know that, oh, you're going to manage yourself. So there are options to modify the designs, including trying to even have rainwater catchment, or you have piping system from whichever tank you put in a rural context, and reticulate that to the facility that you have. So I think it's how we are flexible also in terms of being more innovative with the options also the government has provided, so that it can speak to our context. So the principle should be, even in design, think of the life course approach. Life course in terms of the different age groups that you'd want to use the facilities that you have. We should also look at the issues around inclusivity and equity, understanding that we have different life experiences, disabilities, gender identity, and also understanding the context, including like humanitarian or even informal settlements, so that you're more responsive with your design to the context that you're working with. But yes, there's a guideline from the government. Thank you.
All right. Thank you, Irene. As we conclude, we are running out of time. From Jerry Mwangi, I'm waiting to see the MHM policy document to be launched tomorrow. Talking of raising awareness, maybe we should have commercials on radio, TV, etc. with a male cast educating the public in ways that encourage the conversation. I hope this is included or can be included in future. We've seen numerous commercials about COVID. MHM is equally important. So I think this is just to prompt all of us to take action when it comes to MHM, both from a manufacturing perspective, policy, and at the grassroots level. May we just come out and just let's make MHM as a common discussion as it can be in our various spaces. So thank you so much, Alfred. Thank you, Irene. Thank you, Umi. Thank you, Andres and Victor as well for joining this discussion, and everyone else who has participated. Thank you for your questions. This was a very engaging discussion, and we're happy to just come up with a document at the end of this, which you can share with everyone. Tomorrow is the Menstrual Hygiene Day officially. We just decided to do this today. So in terms of social media engagement, there's a hashtag, it's time for action, and hashtag MHDay 2020. So let's engage on social media, on Facebook and on Twitter, and keep discussing menstrual hygiene so that we can just grow, and for it to be a discussion that it should be in the future and even today. Let's reach out to as many people as we should be, both at the workplace and in schools and in terms of the government. So I'm happy to have everyone on board, and thank you so much for joining. Thank you so much for the discussion. Yeah, have a good afternoon. Bye, everyone.
Thank you.